The abdominopelvic cavity, which is bean shaped, is divided into an abdominal cavity proper superiorly and a pelvic cavity within the pelvic brim. So today we'll be dealing with the anterior boundary of the abdominal cavity, which is the layers of the anterior abdominal wall. Let's start with the surface landmarks. So anyone who is interested in fitness among you would know that the anterior abdominal wall, or the core, part of the core, is the toughest area to train in the body. So we are going to deal with the surface anatomy of the abdominal wall. So if you think of a person who is physically fit, we can see certain projections of the muscles and certain linear ridges. The two of these linear ridges you need to know for the introductory session. So in the midline of the anterior abdominal wall, there is a vertical ridge, which is known as linea alba. Linea means line and alba means white. Whereas in the paramedian region as well, which is lateral to the midline, there are two vertical ridges on either side of the anterior abdominal wall, both on the right and left side. The paramedian linear ridge is called the linea semilunaris. It is curved and somewhat half moon shaped. So these are the two surface landmarks I want you to remember for anterior abdominal wall. Now, how are these lines formed? It is because of the presence of the underlying muscle. So this is the muscle which helps to form the linea alba and linea semilunaris. The name of the muscle is rectus abdominis. What is the meaning of the word rectus?
Straight.
Yes, rectus means straight. So when you look at this muscle, you know it is a longitudinal muscle and its length spans the entire length of the anterior abdominal wall. So rectus abdominis, you can see there is one band on either side of the midline. Rectus abdominis has two longitudinal bands which are connected in the midline by the white fibrous linea alba. So this linea alba forms the surface landmark, whereas this lateral edge of rectus abdominis is what forms the linea semilunaris. Apart from linea alba and linea semilunaris, the rectus abdominis also has certain horizontal tendinous intersections. So all of this contributes to the appearance of the anterior abdominal wall. When you look at this diagram, can anyone just tell me what is the attachment of linea alba? Linea alba, how is it attached superiorly and inferiorly to what bony landmarks? You can just tell me what you know based on the diagram. What do you think?
Xiphoid process to pubic tubercle.
Yes, xiphoid process is correct. Most of you have typed it also correctly. Superiorly to xiphoid process. Anyway, good answer. Whereas inferiorly, it is actually attached to pubic symphysis. Okay, the midline Within the part of the pelvis in the midline is a pubic symphysis. That is about the surface landmark. Now you need to know about the regions of the abdomen. So within this diagram, the abdominal wall is divided into 9 regions. We will learn the details right now. So if you are asked anatomically, how many regions is the anterior abdominal wall divided into? Your answer will be 9 regions. How many quadrants are present? Any guesses? Okay, just think about what is the word meaning of quadrant, and then tell me the answer. Yes, 4 quadrants. Okay, so please keep that in mind. Quadrant means one part out of 4. So some clinicians like to ask this as a trick question, because every one of you will know that the abdomen has 9 regions, but clinically, you will be dealing with the 4 quadrants, which are the right and left upper quadrants and right and left lower quadrants. These quadrants are delineated based on vertical and horizontal lines passing through the umbilicus. So this is important for you in clinical examination. So please keep it in the back of your mind. But anatomically, we are going to deal with 9 regions of the abdominal wall. In order to learn these regions, we need to learn 2 horizontal and 2 vertical planes. The horizontal plane passing through the level of L1 vertebra is the transpyloric plane. Another horizontal plane which passes through the tubercle of the iliac crest at the level of L5 is the transtubercular plane. Whereas the vertical planes that you need to know are the mid-clavicular lines on both sides, on the right and the left. So when there is an intersection of transpyloric and transtubercular plane, along with the mid-clavicular lines, that is how these 9 regions are demarcated. What are the names of these 9 regions? Well, the centralmost region within which the umbilicus is located is known as the umbilical region. Just superior to the umbilical region, the part of the anterior abdominal wall, which is superior to the stomach, is known as the epigastric region. The word epi means superior to. Whereas below the umbilical region, the part of the anterior abdominal wall, which is inferior to the position of the stomach, is called the hypogastric region. So you've learned the names of the 3 regions present in the midline. On either side of the epigastric region, we have the right and left hypochondriac region. On either side of the umbilical region are the right and left lumbar regions. And on either side of the hypogastric region are the right and left iliac regions. So please learn this diagram from your textbook. Each of you need to know what are the 2 horizontal and the 2 vertical planes which help to divide the anterior abdominal wall into 9 regions. These regions are extremely important because it will help you to identify the site of the abdominal organs to aid in your further learning. Also, When you know the names of these regions and the organs associated with it, when the patient presents to the clinic with pain or swelling in either of these regions, you will be able to diagnose what is the organ that is affected based on the symptoms of the patient and the site in which you can elicit these signs. So please be thorough with the 9 regions of the anterior abdominal wall. There are a lot of aspiring surgeons among you. So today's subtopic that we're dealing with next will be of extreme interest and importance to you, because you know that traditionally any surgery that we're performing on the viscera, any organ within the abdominal cavity needs to be approached through an incision in the anterior abdominal wall. Traditionally, it's the open technique of surgery. Nowadays, a lot of surgeries are being done through the laparoscopic or the keyhole method. So whichever technique you are choosing to adopt, you need to know what are the layers through which your scalpel will pass through. What are the layers that are going to be incised or divided during each step of the surgery. So let's take a look at the layers of the anterior abdominal wall. Can you take a guess of how many layers are present within the anterior abdominal wall? Yes, when you feel your abdomen, you think it's soft, but it does provide protection to your abdominal viscera. Remember that there are 8 layers. Now, this is also a must-know topic for each student. We'll look at the layers from superficial to deep. As with any region in anatomy, can you tell me what are the superficial layers of the anterior abdominal wall? It's already labeled and you already know it. Yes, somebody. Tell me, what are the superficial most layers of the anterior abdominal wall, as with any region in anatomy?
Skin and superficial fascia.
Yes, very good. So that's an easy start for you. The first 2 layers of the anterior abdominal wall are skin and superficial fascia. But one thing you have to keep in mind is that the superficial fascia has 2 layers within the abdominal wall. There is a superficial fatty layer, which is called Camper's fascia, and a deeper membranous layer, which is called Scarpa's fascia. So these words are important, especially the membranous layer or Scarpa's fascia. These are the first 2 layers of anterior abdominal wall. So what is the clinical anatomy? I will tell you in a minute. After skin and superficial fascia, the next layer is a layer of muscles and their aponeurosis. The muscles of the anterior abdominal wall you can group as a paramedian layer of muscles. What is this muscle which is present in the central region, which helps to form the linea alba? Yes, in the paramedian region is the rectus abdominis. You can also see there are muscles present in the lateral region of the abdomen on either side of the rectus abdominis. So these muscles are called the obliques, or these muscles are present in 3 layers. These are the lateral muscles, or they are also known as the flat muscles of the anterior abdominal wall. The superficial most muscle is called the external oblique abdominis. Deeper to it is the internal oblique abdominis, and the deepest layer of muscle is transversus abdominis. Right now, I am just naming the 8 layers. We will be learning the details as well. After the layer of 3 muscles comes another layer of fascia, which is called fascia transversalis, deeper to which is a layer of fat called the extraperitoneal fat. And finally, as a protective layer for all the abdominal viscera, there is the parietal peritoneum. Just a word about the skin of the anterior abdominal wall. Can you tell me what are the nerves which supply the anterior abdominal wall? Or intercostal nerves. Yes, intercostal nerve, from the 7th intercostal nerve to the 11th intercostal nerve, the lower 6. They supply the intercostal spaces and the anterior abdominal wall. So please remember, T7 to T11 are the nerves and the dermatomes of the anterior abdominal wall. The next nerve is the subcostal nerve. And finally, in the inguinal region, there are nerves with a root value of L1, which are named as the iliohypogastric and ilioinguinal nerves. So these may be new terms for you, but you will become more familiar with it as time goes by. But right now, please remember the T7 to T11 and the subcostal nerves especially. Now, the umbilicus is an important surface landmark for anterior abdominal wall. Looking at this diagram, can you tell me what is the dermatome at the level of umbilicus? Okay, frequently asked question and of clinical importance. What is the dermatome present at the level of the umbilicus? Just name which nerve supplies that region. T10 dermatome. Good. So please have it branded in your memory. T10 dermatome is what is present at the level of umbilicus. And in a lean individual, the vertebral level of umbilicus is at the level of L3 vertebra. You can go through this nerve supply and learn it by heart. So what is the clinical anatomy of the skin of the anterior abdominal wall? There are certain changes which occur within the skin of the abdomen in the time of pregnancy. Linea nigra is the blackish or the hyperpigmented vertical line which will appear in the midline of the pregnant individual's anterior abdominal wall. Apart from that, the stretch marks which appear at the time of pregnancy are called stria gravidarum. So it is said that the changes within a mother's body is one of the first sacrifices that the mother makes for the sake of the child. These stretch marks that are formed, it's because of scar tissue formation within the dermis of the skin. And stretch marks can also appear other times in life in case of rapid weight gain or weight loss. And these marks will fade over time within years. Now, a question for you from physiology. In what condition do you see purple striae on the abdomen? Stretch marks which are purple in color are seen in which condition? Was endocrinology taught for you in physiology? If so, you would know this answer.
Cushing's
syndrome.
Yes, good, good. Yes, your physiology teachers would be proud of you. Okay, in Cushing's syndrome, there is fat deposition in the abdomen causing truncal obesity. And because of the stretching of the skin, there will be formation of purplish striae. Okay, that's the hallmark feature. So please keep it in mind, Cushing's syndrome. Okay, another question you can learn in physiology is what is the difference between Cushing's syndrome and Cushing's disease? Okay, please go through that. Yes, superficial fascia. So what are the two layers of superficial fascia? Can you name them? Yes, class. What are the two layers?
Fatty layer and deep membranous layer.
Yes, good. Superficial fatty layer or Camper's fascia and the deeper membranous layer or Scarpa's fascia. In this diagram taken from Cunningham, the blue color is the Scarpa's fascia or the membranous layer. So please see that the Scarpa's fascia from the lower part of the anterior abdominal wall, from infraumbilical region of anterior abdominal wall, the Scarpa's fascia also extends into the perineum. The perineum is the region where the external genitalia are present. Scarpa's fascia continues as Colles fascia within the perineum. Also, the Scarpa's fascia extends below inguinal ligament. It's the small part of Scarpa's fascia continuation into the lower limb up to a line called Halden's line. What is the name of the deep fascia in the lower limb? Just an easy question to refresh your memory. Okay, what is the name of the fascia in the lower limb? Do you remember?
Fascia lata.
Yes, fascia lata. So fascia lata is present in the lower limb. Scarpa's fascia will fuse with fascia lata at a line known as Halden's line. Okay, so this is just additional information for those who are interested. You can learn these facts. But all of you have to know the continuation of Scarpa's fascia into the perineum. So in this diagram as well, the blue color is the Scarpa's fascia, and you can see how it is extending into the perineum. So this region, which is labeled in blue color, it is called the superficial perineal pouch. So there is a potential space which continues from the anterior abdominal wall and is connected with the superficial perineal pouch. So here in this diagram, you can see the urethra, how it is traveling from the pelvic cavity into the perineum to finally open to the exterior. So in case of a clinical condition, in case of injury to the urethra, if the urethra is injured, it causes rupture of urethra and there will be leaking of urine into the superficial perineal pouch. Now this urine can also extend into the potential space deep to the Scarpa's fascia. And this patient who has rupture of urethra will present with a swelling in the infraumbilical region of anterior abdominal wall. This is because of the continuity between Scarpa's fascia and Colles fascia. So please keep this clinical aspect in mind. Now, Because of the presence of Halden's line, this urine which has leaked into superficial perineal pouch and anterior abdominal wall, it will not extend into the thigh, because at Halden's line, fascia lata and Scarpa's fascia are fused. So there will be a circumscribed swelling in the infraumbilical region of the anterior abdominal wall and the superficial perineal pouch alone. Once you learn this anatomy, you can correlate the clinical aspects. Next layer of the anterior abdominal wall is the layer of muscles and aponeurosis. As in any muscle, you need to learn the origin, insertion, action, and nerve supply. The paramedian muscle, you already know it as the rectus abdominis, and there is a smaller muscle known as the pyramidalis. We are going to learn attachments of rectus abdominis. The lateral muscles, we have learned it as the external oblique. See, this is the morphology of external oblique. Laterally, there are the muscle fibers, whereas towards the center, there is the external oblique aponeurosis. Okay, so this external oblique aponeurosis actually covers the rectus abdominis. See, rectus abdominis is present in the midline. When you are doing the dissection and when you reflect the skin and superficial fascia, and you come to the layer of muscles, you can see that laterally there is external oblique muscle, and towards the midline, there is the external oblique aponeurosis. External oblique aponeurosis will cover the rectus abdominis muscle. Deeper to external oblique is the internal oblique muscle, and the deepest layer is transversus abdominis. So when we are learning the attachments of rectus abdominis, I just want to refresh your memory regarding the parts of the pubis. In the midline, the secondary cartilaginous joint is a pubic symphysis, whereas the body of pubis has a raised portion superiorly called the pubic crest, and the lateralmost portion of pubic crest is the pubic tubercle. Okay, so please keep these words in mind: pubic crest and pubic tubercle. You need to know the difference between the two. So pubic crest is the raised elevation present on the superior aspect of body of pubis, whereas pubic tubercle is the raised elevation present at lateralmost portion of pubic crest. And the superior border of the superior ramus of pubis. Okay, this is the superior ramus of pubis. It has a superior border, which is known as pecten pubis. Please refresh your memory regarding these parts of the hip bone. So based on this diagram, let's look at the attachments of rectus abdominis. So the origin is from the inferior aspect. Origin I have labeled in red. Origin is from pubic crest, pubic tubercle, and pubic symphysis. And what about the insertion? Yes, based on this diagram, can you tell me the insertion up here? Yes, just based on the diagram, just guess the insertion of rectus abdominis muscle.
Costal.
Yes, costal cartilage. Good. Yes, you have to name the costal cartilage. It's 5, 6, and 7th costal cartilage. Yes. Along with costal cartilage, is there anything else? Okay, in the midline. There's a xiphoid process of the sternum. Good. Yes, very good participation, class. Good. So if you know this diagram, you can just tell the attachments on your own. Okay, so remember the origin is from the inferior aspect and insertion is to the superior aspect. And the tendinous intersections that I told you about, okay, there are 3 tendinous intersections for rectus abdominis at level of xiphoid process, at level of umbilicus, and in between the 2. So that tendinous intersection is what helps to form the appearance of the 6-pack. Okay, the tendinous intersections are present so that the rectus abdominis will be having shorter segments, which will increase the power of action of the muscle. You can imagine if the intersections are absent, the rectus abdominis will be hanging like a curtain from the origin to insertion. Because of these intersections, there is more strength to the shorter segments of the muscle. Now there's one more muscle present along with rectus abdominis known as pyramidalis. This muscle is absent in some individuals. A small muscle taking origin from pubic symphysis and getting inserted to linea alba. The nerve supply of rectus abdominis is by the lower 5 intercostal nerves along with subcostal nerve. Nerve supply of pyramidalis is the subcostal nerve alone. Yes. What about the action of these paramedian muscles? This is the action. So now can you tell me what is the action of rectus abdominis? And also you can name what is the name of this exercise that this person is doing. Yes, flexion of vertebral columns. I want you to remember this, okay? Even when you sit up from the lying down position, the rectus abdominis causes flexion of the vertebral column.